Things were so bad. Most health workers who wanted to go out of Zimbabwe had left. Drug supply had dried up completely. Maternal mortality ratio just went up.
My name is Dr. Emmanuel Chagonda. I'm 29 years of age. I've been working at Chiwi District Hospital for the past 11 months. When I arrived here, I was working on by myself for the first 5-6 months. It was hectic in between, but it was a challenge in life. There was a lot of work to be done.
Chiwi District Hospital is a referral hospital for some 18 rural clinics in the southern Zimbabwean province of Masvingo. Most of the patients are women and children. For 3 years, before Dr. Chagonda was appointed, there was no doctor here. Now there are 2, with a third on the way.
These are the mothers that come with their under 5s.
In the maternity ward, Dr. Chagonda checks in on his patient, Mercy Muchero. She was admitted yesterday after she was forced to give birth on the side of the road while on her way to the clinic. During birth, her uterus prolapsed and she was in dire need of medical attention.
As
soon as we got to the labor ward, the midwives took the baby and started to tend to me.
A few years ago, when conditions in the health sector were at their lowest, Mercy may not have been so lucky to have found skilled health workers attending to her. An economic crisis which peaked in 2008 brought the health sector to a standstill, forcing hospitals to close their doors and thousands of healthcare professionals to flee the country in search of work. As a result, the maternal mortality jumped threefold from what it was in 1990. Infant and child mortality also shot up dramatically. Sister Catherine Mariposa, who has been at the hospital since 2003, remembers those dark days.
As a professional, you get so touched, especially if you know that something could have been done. And this death was avoidable. It's so hurting.
To bring these mortality rates under control and revitalize the ailing health sector, the government, together with the international donor community, including the European Union and UNICEF, created a health transition fund.
The main objective is to reduce maternal mortality at least by 17% and to reduce child mortality, under 5 mortality, by 36% until 2015.
One of the main goals of the Health Transition Fund is to make sure that there are doctors and nurses in all hospitals and clinics, especially in the rural areas. To help incentivize professionals, salaries are topped up and health centers have access to basic supplies and medicine provided by the Health Transition Fund.
Midwives were highly motivated by this fund and we hope it's going to continue.
But years of underinvestment in the sector are evident, and Chiwi District Hospital is no exception. Broken and outdated equipment and lack of water and electricity provide huge challenges for healthcare workers. And recruiting skilled staff takes time, but so does restoring confidence in the people.
The biggest challenge is the health education of the mothers, to saying you should be confident with your institutions. Come to the institution and have deliveries.
A new policy to remove user fees for pregnant and lactating women and children under 5 will provide a welcome boost to the number of women accessing health centers.
Women and children are no longer being charged. That means access has improved. That means we are going to deal effectively with the issue of maternal mortality and neonatal child mortality.
To improve skills and alleviate pressure on already strained resources, especially in district and provincial hospitals, hundreds of nurses from rural clinics like Anna Mungara are being trained as midwives.
I had some difficulties in conducting some deliveries, so I applied for midwifery so that I can be trained and have the knowledge and have the skills so that I can conduct the deliveries and promote safe deliveries so that the maternal mortality and morbidity rate will become low.
This is sure to help restore confidence by allowing pregnant women to get quality service wherever they are from the word go. In addition, the Health Transition Fund is making sure that pregnant women receive guidance and care from village health workers who are with them throughout their pregnancy and encourage them to move closer to their local clinic when their due date is near.
The village youth worker come regularly to check on us and to give us advice on how to take care of ourselves and let us know when we should go to the hospital. That's why the last time I was overdue, because there was no one to tell me it was time to go to the hospital.
Restoring these vital building blocks of Zimbabwe's health sector does not happen overnight, but the hope is that these efforts will have a long-lasting impact.
I think that a transition period is meant to help the government to assume its responsibility. It's not something that you can do from one day to the other. There are still issues, in particular referred to the revenues of some of the important extractive sectors in the country that have to be clarified or improved, and that would permit to the government to have more resources in order to face its responsibilities. It's a long process. I'm not sure that the day after tomorrow we will be there, but the important thing is that we are progressing towards that goal.
Back at Chiwi District Hospital, Dr. Chagonda is finishing his rounds. Today he must start at the 18 rural clinics he also services. It is a tireless job, and the reward is humbling.
The most satisfying thing about the nature of my job is to see someone smiling again. You tell me. Okay.